Excuse me, you need to stop right there.
Hi, yes, is something wrong?
I haven't seen you before. Where are you going in those
I work
scrubs?
here. I'm heading to the pediatrics ward.
Sure, I need to see your ID right now.
My ID's upstairs, but I have my badge.
I don't care about your badge. You look out of place.
Difficult.
What's going on here?
Retail justice files. Cop Harasses black doctor outside hospital. Lawsuit costs city millions. Blake Mercer had no idea what he just walked into. In the next 48 hours, hospital administrators would be reviewing security footage, legal teams would be drafting letters, and Mercer's 12-year career at the hospital would be completely over. The woman in scrubs he confronted was not a visitor. She was not a contractor. She was not trying to sneak into the hospital. She was Dr. Sarah Chen, board-certified pediatrician, 18 years of medical experience. Yale Medical School graduate, chief of pediatric oncology at Metro General Hospital. Her credentials were documented in the hospital system. Her ID badge proved who she was. Her office was listed on the directory outside her door. But none of that mattered in that moment. What Mercer saw was different, and every second of this interaction was captured on 3 separate security cameras, witnessed by 2 nurses, documented by hospital timestamp logs. Within 6 weeks, the city settled for $4.2 million. Blake Mercer never worked in security again. Before I continue, let me ask you, have you ever been treated unfairly by someone in power? Drop your answer in the comments below. Blake Mercer had no idea who he was stopping that afternoon. Dr. Sarah Chen was the chief of pediatric oncology. That means she ran the entire children's cancer program at Metro General. She supervised 14 staff members. She managed complex cancer cases for sick children. She had 18 years in medicine, 8 of those years as a senior doctor, 5 years working specifically with pediatric cancer patients. She went to Yale School of Medicine. She trained at Boston Children's Hospital. She was board-certified in pediatrics and in cancer care. She published research. She mentored younger doctors. She was nationally recognized in her field. But none of that mattered when Blake Mercer saw her in those scrubs. On this Tuesday afternoon in March, she was simply heading back to her office. She had just finished rounding on 3 pediatric patients in the ICU. She had no idea this moment would change everything. Now here's what happened next. Blake Mercer had been working hospital security for 12 years, but his file told a different story than his job title suggested. He was 47 years old, married, father of 3 children. Public records showed 2 prior complaints of racial profiling. In the past 24 months alone, 7 complaints were filed against him. 7, and they all followed the same pattern. He would stop black employees. He would stop black contractors. He would stop black visitors. He would demand ID and question their presence. Every single incident. One complaint came from a maintenance contractor he stopped 3 times in 1 week. Another involved a registered nurse he questioned about her badge. A third involved a black vendor making a legitimate delivery. The nursing staff had a nickname for him. They called him the ID guy. They knew what he was doing. They had warned him before, but nothing happened. No investigation, no discipline, no real consequences. And that's important to understand because on this day, Blake Mercer was about to discover that some people have the resources and credentials to make a point very loudly indeed. Let me know what you think about this pattern in the comments. It was Tuesday, March 14th, 2023, 3:47 in the afternoon, Metro General Hospital, East Wing, the employee corridor connecting the ICU to the pediatric oncology department. The afternoon shift was busy, beeping monitors muffled behind closed doors, soft fluorescent lighting, linoleum floor reflecting hallway motion, quiet hum of medical equipment, occasional paging system announcements. 8 to 10 staff members were visible on that corridor at that time. 2 nurses pushing medication carts, 1 resident carrying patient files, 2 custodial staff cleaning. Blake Mercer came around the corner on routine patrol, full security uniform, visible weapon on his belt. He had been on shift for 6 hours. He spotted Dr. Chen in scrubs, made eye contact, positioned himself directly in her path. "Hold up," he said. "I need to see your ID." Dr. Chen stopped. She looked confused. She worked here. They had passed in hallways before. She reached for her hospital badge. "Of course," she said. "It's right here." That's when everything changed. If stories like this matter to you, hit subscribe. We upload videos every week exposing patterns just like this one. Mercer held up his hand. "No badge," he said. "This is a secure area. I don't recognize you. I need actual photo ID." Dr. Chen spoke calmly. "I work here. I'm Dr. Sarah Chen. I'm heading back to my office in pediatric oncology. My hospital ID is in my pocket." Mercer shook his head. "I've been here 12 years. I know the doctors in Thai." This hospital, I haven't seen you before. I work in pediatric oncology, she said. I've been here 8 years as an attending. I was in the ICU this morning, rounding on patients. I'm going back to my office now. Convenient, Mercer replied. Look, I'm just doing my job, you understand. In this post-9/11 world, I have to verify everyone. I understand, she said, but I really need to get back. I have charts to review before my 4:30 consult. Mercer stepped closer, blocking the corridor entirely, raising his voice so others could hear. Not until I verify who you are. This is a restricted area. You could be anyone. I'm a physician, she said firmly. I work here. This is unnecessary. You can call pediatric oncology if you don't believe me. You're being difficult, Mercer said. I think you need to come with me to the main desk. We're going to verify this story. I'm not going anywhere, Dr. Chen replied. I know the hospital's security protocol. You can call my department directly. Mercer's face tightened. He placed his hand on his utility belt near his radio. He raised his voice louder. I'm calling the main desk. If you're not cooperating, I can have police come verify your identity. Then everything stopped, because Dr. Chen said 5 words that changed the entire situation. Call whoever you want, she said calmly. But I'd suggest you call my office first, Dr. Chen continued. Dr. Patricia Morrison, department director. She'll confirm who I am in about 10 seconds. Blake Mercer's face went white. He realized immediately that he had stopped someone with real institutional authority, not just another employee, not a contractor he could intimidate, the chief of pediatric oncology. When the main desk called Dr. Morrison's office, the response came back fast. That's our chief of pediatric oncology. She runs the entire department. What's going on? Mercer knew instantly that he was finished, but the witnesses made sure of it. Jessica Martinez was a nurse, 8 years at the hospital. She watched from her medication cart, mouth open in disbelief. She shook her head and said, I've worked with Dr. Chen for 5 years. She's incredible. She knows every patient on our floor by name. This is ridiculous. I'm filing a complaint. Tom Bradley was another nurse, 12 years at the hospital. He recognized Dr. Chen immediately. He spoke up and said, Blake, you know better. You've been told before about this. I'm not staying quiet this time. Dr. Marcus Johnson was a resident. He was one of Dr. Chen's mentees. He stood and watched and said, I recognize Dr. Chen. She's one of my mentors. She's literally in charge of part of this hospital's mission. This shouldn't have happened. The evidence was crystal clear. 3 security cameras captured everything. The hallway cameras showed Mercer's aggressive body language. They showed Dr. Chen staying perfectly calm. Hospital access logs proved she had swiped into the ICU at 2:15 in the afternoon. She swiped out at 3:42. She was exactly where she said she was. Her hospital ID card clearly displayed her title, Chief Pediatric Oncology. Within 15 minutes, Dr. Morrison called hospital administration. Within 20 minutes, David Garcia arrived. He was the chief of hospital security, 25 years in the business, known for being fair. He took one look at the security footage and knew the truth immediately. Dr. Chen simply walked past Blake Mercer. The corridor went silent except for the beeping of monitors. Nobody said anything. They didn't need to. What Blake Mercer didn't understand was that he had just made a mistake that would cost the city millions of dollars. David Garcia reviewed the security footage, all 3 camera angles, 5 minutes 47 seconds total. He checked hospital access logs showing Dr. Chen's legitimate presence. He reviewed her personnel file, Chief of Pediatric Oncology, Yale Medical School, 18 years experience. Then he interviewed the 3 witnesses, Jessica Martinez, Tom Bradley, Dr. Marcus Johnson, all told the exact same story. Then Garcia checked something important. Blake Mercer's complaint history, 7 complaints over 24 months, every one involving racial profiling, but nobody had investigated any of them. Nobody had disciplined him. That was the pattern Garcia found. By the next morning, David Garcia had seen everything he needed to see. Blake Mercer's story fell apart instantly. He claimed Dr. Chen wouldn't provide ID, but security footage showed her offering her hospital badge immediately. Mercer refused to even look at it. He claimed he didn't recognize her as hospital staff, but access logs proved she had swiped in using her hospital badge. Her photo was on the hospital directory. He claimed he was following security protocol, but hospital protocol said security could verify staff through the system. Mercer skipped verification entirely. He went straight to confrontation. By 5 o'clock that same day, hospital administration made their decision. Immediate suspension pending investigation. By Friday, the termination letter was drafted. Violation of hospital non-discrimination policy. Failure to follow security protocol. Pattern of racial profiling. Blake Mercer tried to fight back. He denied everything. He said everyone stops people sometimes. He said this was unfair. He requested a meeting with the hospital director. He tried to apologize to Dr. Chen, all rejected. The staff rallied around Dr. Chen. Colleagues sent cards. Flowers arrived at her office. Pediatric patients' families who heard the story sent messages of support. Hospital administration issued a memo to all staff. This was unacceptable. This will change. But Blake Mercer didn't know that someone had been recording this entire thing on their phone. And that video was about to show the world exactly what happened in that hallway. If you're watching this and thinking justice matters, hit subscribe. We'll keep bringing you stories that expose these systems. Wednesday morning at 10 o'clock, a witness posted a 45-second clip to Instagram. The caption read, "This is why black doctors don't feel safe at work. Watch what happened to my colleague." By 2:30 that same afternoon, the video reached 50,000 views. Twitter began trending a hashtag. Local news picked it up. By 6 o'clock Wednesday evening, the video had reached 250,000 views. By Thursday morning, national news outlets were calling. CNN, MSNBC, NBC, they all wanted interviews. By Thursday midnight, the combined views across all platforms were 8.7 million. Instagram had 3.2 million views, 89,000 shares. Twitter reached 2.1 million impressions, 14,000 retweets. TikTok had 2.8 million views. Facebook had 1.6 million views. The public response was immediate and strong. People commented, "This is racism in real time." And she handled it with more grace than I could have. Another said, "She's a pediatric oncologist. She saves children's lives." And this man questioned if she belonged in her own hospital. Someone else wrote, "This is what bias looks like, and it needs to stop." Local news outlets reported, security guard fired after confronting black physician at Metro General. National outlets reported, Yale-educated pediatrician subjected to racial profiling by hospital security. Medical journals picked up the story. They discussed racial disparities in workplace safety for black healthcare professionals. Metro General Hospital issued an official statement. "We have zero tolerance for racial profiling or discrimination. Blake Mercer's employment has been terminated. We are implementing mandatory bias training for all security personnel. We are reviewing our security protocols." Blake Mercer tried damage control. He attempted to contact local reporters. They refused to speak with him. His social media accounts went private. Old posts showed controversial comments. He tried to post an apology. The community immediately called it insufficient. He tried to claim he was being unfairly targeted. That narrative didn't gain any traction. This story was shared millions of times. Share it if you think others should see what really happened. 3 days later, Blake Mercer's legal team reached out to the hospital. They asked a desperate question. Could this be settled quietly? The answer was no. Dr. Sarah Chen, represented by civil rights attorney Michael Ramirez, filed a lawsuit on May 3rd. She sued Metro General Hospital. She sued Blake Mercer personally. She sued the city. The claims included racial discrimination, violation of civil rights, emotional distress, violation of workplace safety, negligent supervision by the hospital. During discovery, something important came out. Hospital files revealed 7 prior complaints against Mercer over 24 months. The hospital had conducted zero investigation into any of those complaints. The hospital had provided zero training to Mercer despite the complaints. Hospital hiring records showed a pattern. They hired individuals with prior discrimination complaints. The hospital had also settled other racial profiling cases before. 2018, $180,000. 2020, $240,000. They knew this was a problem. They did nothing. The settlement came quickly. Metro General Hospital and the city wanted this over. Direct damages to Dr. Chen, $2.5 million. Emotional distress and lost wages, $800,000. Hospital legal fees, $900,000. Total settlement, $4.2 million. Paid by the city of Metro General, but money wasn't the only consequence. Blake Mercer was permanently banned from working security in the state. He had to pay $150,000 directly to Dr. Chen. The hospital was required to implement bias training for all 400 security employees within 6 months. They had to establish third-party oversight of the security department. They hired a diversity officer for the security division. The settlement became public record. The case became a teaching example in law schools. Medical schools taught future doctors about this case. The amount they paid, $4.2 million. Let me know in the comments if you think that's enough justice. 6 months after the settlement, Dr. Chen sat for a formal interview. She spoke in her office at Pediatric Oncology. Her walls were lined with thank you letters from families, children whose lives she had saved. She talked about the impact. The first week after the video went viral, I cried, she said, not because I was sad, because I was angry. And I realized I had been carrying this anger for years without knowing it. Every time I walked through a hospital hallway, a store, the street. It was this underlying anxiety. Would I be questioned? Would my credentials matter? This incident just made it clear. She talked about her work. I'm a physician. I have a Yale degree. I've treated hundreds of children with cancer. And none of that mattered in that hallway. What mattered was what he saw. So imagine what healthcare workers without my education or credentials face every single day. This is a systemic problem. She had a message for workers facing similar situations. You have rights. You do not have to accept abuse in your workplace. No matter how powerful the person is, document everything, find witnesses, know that there are people, lawyers, organizations, communities who will stand with you. She had a message for everyone else. Respect isn't optional, credibility isn't determined by how you look, and consequences for disrespect matter. They should always matter. When asked what needed to change, she was clear. I want hospitals to hire security who understand that black doctors, black nurses, black staff are not security threats. I want bias training that actually works, not just checking a box. I want hiring and accountability systems that don't let discrimination slide. At the end, she said, one doctor can't change a system, but one incident, when it's seen, documented, and fought, can shift how an entire institution thinks about power and power. Studies show that 26% of black physicians report workplace discrimination every year. Black healthcare workers are 2.5 times more likely to be questioned about their credentials. Hospitals have settled over $47 million in discrimination cases since 2015. Only 5% of hospitals have implemented third-party oversight to address bias in security. Dr. Chen's case exposed what many face silently. The difference was that hers was caught, documented, and witnessed. Most discrimination cases never get that attention. The core issue is this. Systems treat authority as inherently white. When black professionals assert themselves, they're seen as threats rather than leaders. Complaint systems exist, but aren't monitored. Legal burdens fall on victims, and institutional power imbalances mean most discrimination goes unaddressed. Following the case, hospitals began implementing changes. Metro General required security to verify credentials electronically before confrontation. Quarterly audits tracked stops by demographic data. 3 other major hospital systems implemented similar oversight. The American Hospital Association released new guidance. 23 major hospital networks adopted the framework, but most security still receives minimal bias training. Most complaint systems lack transparency or external oversight. Healthcare workers still risk retaliation for reporting discrimination. So let me ask you, have you worked somewhere that treated you unfairly because of how you look? Do you know someone facing this right now who stayed silent because they thought nothing would change? Do you believe that one video, one lawsuit, one settlement is actually enough? Because if we don't address bias training that works, if we don't create accountability systems with real teeth, if we don't shift culture that assumes authority based on skin color, then we're just waiting for the next Blake Mercer, the next Dr. Chen, the next video going viral, the next $4.2 million settlement. And most people won't have Dr. Chen's credentials or legal resources. Most will suffer in silence. Comment below if you believe hospitals should face financial consequences for letting bias operate unchecked. Because I do. If you think stories like this matter, hit that subscribe button. We're going to keep exposing these patterns. We're going to keep naming systems that protect discrimination. We're going to keep demanding accountability. We're going to keep fighting for black professionals who deserve respect. For workplaces where credentials matter more than appearance, for systems that see human beings instead of assumptions. This isn't just about one security guard or one doctor. It's about all of us and the systems we're willing to tolerate. Are we going to tolerate them, or are we going to demand better? See you in the next one.